Um, I was delighted that Michelle started by showing in that map how there are people left behind, and that the CDC is also showing how there's just whole regions of the country left behind in terms of these policies. I'd like to also be sure that we acknowledge, Brian, that among one of the most important worldwide efforts, since we've been talking about scale and spread, is the tobacco regulation and the fact that WHO has taken a very strong, comprehensive approach, and the Framework Convention for Tobacco Control has all of those elements and has made over 177 signatories, and the US is not one. So I wanted to say that because we are now talking about a different context, the world is here. That's how I see it. And this is the new world. Since 2000, it's been 20 years that I've been saying, hey, look at how the demographics of the country have changed and how the demographics are changing. And we may have programs, but are we scaling them to reach those populations? And I would venture to say that not yet. I think that the poverty issue in the last 20 years has gotten worse, and therefore this has having an impact also on smoking, since the higher, the poverty rate and the lack of education, the higher the smoking rates. I think that it's great that we keep on harping how wonderful 18% of the population is now smokers compared to 42 when we started, but nonetheless, we have to see that this is 12 to 17-year-olds, and there is diversity, diversity, diversity. The same thing is also for 18 to 25-year-olds. As you know, 99% of adult smokers started smoking before the age of 25. Ergo, we haven't been concentrating on the 18 to 25-year-olds. And this is showing. If we have this at the young adult population, and yet we're saying we're at 18%. You know, I was asking about the data and saying to you, data is also what is happening in terms of products. We're dealing with an industry that if we attack one product and regulate one, they spring up with 10 others. Menthol is one of these issues. It's the starter cigarette, and we still haven't made a dent on on banning it. So, the diversity of the populations. Asian Americans are the group that in the last decade has grown more than any other group, including Latinos. So we have to look at this and say, this is what's left behind. We've already shown that in terms of smoke-free air and the impact of other illnesses, including diabetes, still segmenting and being in that. What have we done? RWJ, this hasn't been done just by happenstance. The Smokeless States Project was an RWJ-funded project that really helped move those states that you see with gains in terms of smoke-free. I think RWJ had a lot to do with it. Then Legacy comes in and starts to support also some of the priority populations. Believe me, they were the first ones to actually acknowledge and set up that, and funded with Robert Wood Johnson as well. So the idea was to create networks in priority populations. In those cases were racial and ethnic groups. We started with that, and now it's also LGBT communities because they're the hardest hit. And those networks were to garner all of the information and disseminate it to specific communities and have them mobilize in support of these policies. Okay, but we're dealing with, in terms of scaling up, when you have networks that receive $400,000 to reach the whole nation and the territories, you'll find it very difficult to be able to partner with the states or with other people because you need the money at the local level to get. So we have the great ideas, okay? But do we have seedlings coming in there? Do we have people at the local level being able to build that capacity? I just want to highlight a couple of promising practices that we have done as the Latino network and as multi-ethnic networks. We created a series of promising practices, and I will share with you in a minute once we were asked. But the issue is we don't have the data in our communities to be able to help mobilize those communities. You come into New York City, and Puerto Ricans have the highest, especially women, highest smoking rates, okay? And yet Latinas in general have the lowest smoking rate. How is that? So you need to make it real at the local level. Data has to be relevant to that community in order for that community to see themselves reflected and engaged. I love it, the zero. You know, you're asking about engagement. When the tobacco industry has been funding Latino organizations and minority organizations for 25 years, okay? And Texas is a good example, all right? The NAACP and the National, and the League of United Latin American Citizens, the two top civil rights groups in San Antonio, they testified against clean indoor air. So you have also the fact that you have an industry who has been working to create and empower their own smokers and the communities to speak in favor of their point of view. And they're doing it also, you know, on the not food element. So we do have in here the idea that, yes, you may have promising practices, and we have developed promising practices. We did that when we call it the 7 years of the fat cows. Right now, we're going to the 7 years of the lean cows. There was money in tobacco control at one point. And now there is very little money. So this constant flow, what I call the desert flood issue, in terms of at the bottom level of the community, affects the notion of promising practices, scaling those promising practices, evaluating them, and actually launching national efforts with that. When at the bottom, there were 160 community-based organizations funded in California at the height of that work, and now there are 34. And out of those 34, actually there are less now. It's the counties that are receiving all of the funding. So done. Not quite. So I wanted to say that, to me, if the element of community engagement is not in there as a priority, okay? And if all policies are local, they may be global, but they're local, and we're not funding them to actually drill down, we're going to find ourselves with great trickle-down effect. Oh yeah, all policies, we're going to lift all boats. Ladies and gentlemen, I'm willing to say it hasn't happened in tobacco control. And so it has lifted some boats and some shaky boats, but not at the level of what we need to do when we look at what are, in my opinion, the concerns. The concerns for me is not about now. The concern is 1 out of every 2 kids right now in this nation are kids of color. 1 out of every 4 is a Latino. 1 out of every 3 of those kids is poor. So what are we looking at? An industry that's predatory, an industry that loves it, that's fantastic, okay? And where are we going to be 20 years from now? Because we don't have that infrastructure, and the industry has eaten up our seedlings. So we need to be thinking about that. To scale up, you need solidity, you need capacity, you need leadership, and we haven't been funding that. And the great programs in terms of youth that North Carolina had to be slashed. All over the country, we've been slashing that, okay? And so we need to be thinking more about what is it that we fund that stays solid. And then we can scale. We know what works at the community level, like the people from the environmental justice and the Zero campaign are saying. People know what works, okay? It's now, how do you have those voices, that strength and that support to them and the TA and training to get that to work? So for me is every time we make progress, we have to think about who do we leave behind, because that entrenched smoker is going to be victimized, is going to be rejected, okay? And it's now a mental health substance abuser who wants to see him or her. And the issue is turning that around and saying, no, that's us. It has to be our joint responsibility. Thank you.